my name is Nicole. I'm going to be your nurse today. I realize this is a really hard time for you, but if you could explain to the best of your ability with as much detail as possible what happened, could really help with our investigation and a further assessment.
I don't really remember what happened. I was just in the park and then I was attacked.
Thank you for explaining. I realize that was probably really difficult. You can take a few moments to gather your thoughts, and then I'm going to continue with the neuro assessment. If at any time you feel uncomfortable, once more explanation, just let me know, okay? I'm here to help. So for the first cranial nerve assessment, we're going to test your sense of smell. I'm going to have you close your eyes, occlude one nostril, and then smell something, and then we'll do the same for the other nostril. Any questions? No? Okay.
Cranial nerve 1, olfactory. This nerve is responsible for our sense of smell and can be damaged during strangulation, especially if the victim's head was shaken back and forth during the attack. In order to assess this nerve, you would have the patient close their eyes and identify a familiar scent. An abnormal assessment would be if the patient cannot accurately identify a familiar scent. 40% of people who suffer from injury to the olfactory nerve will regain their sense of smell.
Okay, so go ahead and close your eyes for me and occlude one nostril. There you go. And then identify the smell.
Vanilla.
Yes, okay. Then keep your eyes closed and go ahead and close the other nostril. And identify the smell.
Alcohol.
Yes. Okay. So for the next assessment, we're going to test your visual acuity.
Cranial nerve 2 is the optic nerve. It is used for sight. Assessment of the optic nerve is covering one eye at a time and identify how many fingers are in each visual field. If there were any signs of strangulation, the patient would see spots or have tunnel vision. Normal findings would be the patient would be able to identify the amount of fingers being held, and they would not see spots or have tunnel vision.
I'm going to have you close one eye and identify the number that you see with the best of your ability. So go ahead and close one eye, and then let me know if you can identify this number.
I see a lot of black dots, but I think it's 3.
Okay.
2.
And last one.
1.
Okay, and we're going to do the same thing with your other eye.
I still see a lot of black dots.
Okay.
2.
And last one.
1.
Okay, good job. Now I'm going to be checking your pupil response to light. So I'm just going to have you look straight forward, and I'm going to shine this light in your eyes, okay? Now I'm just going to be looking for extra movements with your eye.
Cranial nerve 3, oculomotor. This nerve has 3 motor functions, and they are innervation to the pupil and eyelids, movement of the upper eyelid, and controlling the group of eye muscles responsible for visual tracking and gaze fixation. The assessment would be to check pupillary response with light and assess accommodation by having them follow your fingers. Upon observation, petechiae is often present in the sclera of the eyes. An abnormal assessment can be a sign of an underlying aneurysm as a result of the strangulation and would warrant further assessment by the physician. Damage to this nerve may also cause vision problems.
So if you could follow my finger with your eyes. nose. Okay, now I'm going to have you look down towards your nose and up and then to both sides. Great.
Cranial nerve 6 would be the abducens nerve. This nerve is also used for eye movement. Assessment for this nerve would be move eyes to side to side. Signs of strangulation would be that the patient would present with petechiae as well. Normal findings would be that petechiae will not be presented at all.
I'm going to check the motor and sensory function of your face.
Cranial nerve 5, trigeminal. The main function of this nerve is to transmit sensory information in the face, but it is also responsible for jaw movement. This is one of the most widely distributed nerves in the head. Assessment would be to open the mouth against resistance, move the jaw laterally, close their eyes and touch their face with a cotton swab and have them tell you where they felt the touch. An abnormal assessment finding would be severe pain upon even light touch, which is called trigeminal neuralgia and is often caused by a blood vessel compressing the trigeminal nerve, which can be a result of trauma, among many other things.
So I'm going to have you open your jaw and I'm going to push a little resistance. And how does that feel?
It's really sore.
It's sore. Now I'm just going to have you move your jaw from side to side. So go ahead and move your jaw this way. Very good. And the other way. Very good. Now I'm going to have you close your eyes and I'm going to touch your face with a cotton swab and I want you to identify where you were touched. Any questions? No? Okay. So close your eyes. Could you feel that? No? And then one more time. Can you identify where you were touched with a cotton swab? No? Okay. So I'm going to have you show your teeth for me. Very good. And I'm going to have you raise your eyebrows.
Cranial nerve 7, the facial nerve. This nerve is responsible for moving the muscles responsible for facial expressions, taste, salivary glands, and tears. Assessment of this nerve would be to have the patient smile, raise their eyebrows, close their eyes and their lips. An abnormal assessment finding of strangulation that you would see on this would be eyelid drooping.
All right, now I'm going to have you close your eyes and your mouth, and I'm just going to use my hands to try to open them and try to keep them closed. Great. I'm going to do an assessment on your ears. I'm going to have you turn towards the door, close your eyes, and then identify which ear you hear rubbing of my fingers, okay? So go ahead and turn a little bit that way.
Cranial nerve 4 is the trochlear nerve. This nerve is used for eye movement. Assessment of this nerve would be having the patient look down and inward. Signs of strangulation would be that petechiae will be presented in the eyes. In normal findings, petechiae will not be seen at all.
And close your eyes. And then can you hear which ear I'm rubbing my fingers?
No.
No?
There's a lot of ringing.
A lot of ringing? Okay. And one more time. Just ringing.
Mm-hmm.
Okay. So now I'm going to check the motor function of your shoulder and neck muscles, okay?
Cranial nerve 11, spinal accessory. This nerve is responsible for the movement of the neck and the shoulders. Assessment. Have the patient shrug their shoulders against resistance and move their head from side to side. An abnormal assessment finding of strangulation would be if the patient had neck pain when moving their head from side to side.
So I'm going to place my hands on your shoulders, and if at any time you feel uncomfortable, want a minute to take a break, want some more explanation or anything, just let me know. I'm going to place my hands on your shoulders, and then against resistance, I'm going to have you lift them up. Sound okay?
Mm-hmm.
All right. So go ahead and lift your shoulders up. Great. And now I'm just going to have you turn your head, so turn this way as far as possible.
It's pretty sore.
It's sore.
Mm-hmm.
Okay. And then towards the door as far as possible.
It's still sore on that side too.
Okay. For the last cranial nerve assessment, I'm going to have you stick out your tongue as far as you can and move it from side to side. And this just tests your motor function of your tongue, okay? So go ahead and stick it out as far as you can. Great. And then from side to side. Perfect.
Cranial nerve 12 is the hypoglossal nerve. This nerve is meant for tongue movement. Assessment of this nerve is to tell the patient to stick out their tongue and see if they're able to move it side to side. Signs of strangulation are that the patient is incapable of doing this. If the patient had no signs of strangulation, they would be able to move their tongue from side to side.